Good morning, viewers. Welcome once again to our program, The Science Behind Health, Baraton TV, here and hereafter. Today we have a speaker or a guest speaker on our program, and he is Mr. Evans Oluoch Odiwor. Welcome.
Thank you.
He comes to us from the Department of Public Health, University of Eastern Africa, Baraton. Once again, welcome.
Thank you.
And
very
today our program will be on home-based care in this time of COVID-19. Home-based care for COVID-19. Very important topic. And I'd like for us to begin on that note. And we want to focus on workers and even administrators of health when it comes to home-based care. So, Mr. Oluwaj, I want to ask you, when do you think a patient who has COVID-19, when should that patient be cared for at home?
Okay. Thank you very much, Professor, for giving me this opportunity. Ideally, with respect to COVID-19 infections, mostly COVID-19 patients are cared for in a hospital environment. However, there are cases where there are exemptions where these patients can be cared for at home. One of the exemptions is a situation where maybe the hospital does not have the capacity, the demand for COVID-19 patients maybe has gone too high, and the hospital does not have the capacity to care of the patients in the hospital setting. Maybe the hospital setting is unsafe for care, or maybe some of these patients have some underlying conditions that may require specialized care in the hospital. I mean, not really specialized care, but they have certain difficulties and challenges at personal level that would require them to be in their home setting. Yeah, so those exemptions would require that the patient be taken care of.
Okay, thank you very much. What are some factors that should determine that a patient is cared for at home when the patient is suffering from COVID-19?
Okay, thank you so much for that important question. I think there are certain general factors that may require a patient to be taken care of. One, probably the patient is below 60 years. You know, these are category of patients that are very vulnerable. So the fear of cross-infection maybe in a hospital setting may require that the patient be taken care of at home. Maybe if the patient is obese, maybe you have patients with who are immunosuppressed, like the HIV positive patients. If the symptoms are mild, the disease is still mild, then such patients should be taken care of. But however, there are more specific factors to consider, like before you decide that a patient may be taken care of in a home setting, there should be some level of clinical assessment to determine whether the disease is already severe. I mean, the severity of the disease, so that the disease can you can establish beyond reasonable doubt that the patient can be taken care of in a home setting. Number two, there are certain housing standards within the home, especially in the isolation section, that must be considered. Issues to do with the ventilation, the isolation room or house must be properly ventilated. There's the aspect of illumination, proper lighting within
the home.
That's very, very important. And then availability of caregivers, because you find when this care is provided at home, there has to be a person who is willing to take care of the patient. The caregiver may not be necessarily a medical practitioner, but has to be someone who has the commitment to observe the patient from time to time. And then also, this home-based care must be done under some medical supervision. occasionally you can have a healthcare worker coming in and checking whether the standards are on site at home. With respect to medical workers who decide to self-isolate at home upon presenting with mild symptoms, I think it's very, very important that the home setting also observes the IPC standards, infection prevention standards that are in place in relation to COVID-19. There are these standards that are applied to all infections, but there are these ones that are unique to COVID-19 infections. Things like hand washing, and ability of the patient to regularly wash their hand at critical times. That's very, very important. And then also respiratory hygiene, especially patients who have advanced, the disease are already advanced, and maybe they are seriously coughing, they are sneezing. So their respiratory hygiene becomes very, very critical, because you want a situation where maybe the patient understands that with that condition, to protect the rest of the household members, maybe they cough through and sneeze through their elbow, and if not, they have disposable, tissues that we can, cough into and safely dispose. Those are some of the, personal standards that we must do.
Thank you very, very much, Mr. Oluoj. Actually, you have, told us very important things to do with infection prevention and control.
Yes.
And those measures for COVID-19 patients who have been taken care of at home is extremely important. So home-based care, right now we have health facilities that are overwhelmed.
Yes.
So many patients. But we are saying that if a patient can be taken care of at home, it's possible, and it is important for people who may not necessarily have medical background, like you have said.
Yes.
But the patient can be checked on by medical personnel once in a while. So you have told us those things, and I think we should really sit down, think about it, and infection prevention and control measures should be put in place there in the home. So what about the healthcare worker who probably is coming in, to help with this patient who is taken care of at home? What precautions should either the healthcare worker or the caregiver at home, keep in mind when taking care of a patient with COVID-19?
Thank you very much. I think that's another very important area. The healthcare worker has to think about them, has to think about themselves also, because they need to protect themselves. Now, first of all, the most important thing they need to think about is they must assess the level of risk before they get to the home setting. The level of risk that will then determine the kind of PPEs that they need to use. If the disease is already advanced on the assessment, they need to adorn the standard PPEs that are required for their own protection. That includes the gown, the gumboots that they're supposed to use. There are things like the medical mask, standard medical mask. There is also the aspect of the nose protections, eye protection, very, very important, so that they reduce or completely eradicate the possibility of transfer. And then something else, they also need to ensure that the caregivers within the home setting are well informed about COVID-19 protocols. And as medical practitioners, I think they need to also ensure that the basic home standards, the housing standards in the isolation units are met. For instance, while they are attending to the patient, they need to keep the 1 meter physical distance. First of all, even before they get to the room to take care of the patient, they need to wash their hands. These are some of the things that are very critical. Wash their hands so that there is no possibility of transmission. When they're attending to the patient, the COVID-19 patient, the patient should have their medical masks on so that they are not at risk of being infected by the patient. Something else that they need to ensure and follow and advise maybe the regular caregiver at home is on the issues of ventilation of the house, because that then encourages free flow of air. We understand that COVID-19 spreads through droplets, and so when there is proper ventilation and proper illumination, the risk of that spread is significantly reduced. Something else they need to really emphasize or think about as regards to their own protection is the general hygiene around the home. Remember, there's a lot of research that is still going on COVID-19. We know that COVID-19 is transmitted from human to human, but then there's also a possibility of COVID-19 being transmitted by animals. That research is still going on. So the peridomestic environment within of the house or the isolation room where the patient is, where the medical worker also attends to the patient, should be well taken care of.
Very important point there, Mr. Lodge. Very important point there. Okay, about our peridomestic environment should be well taken care of. When you have a COVID-19 patient at home, please take note of that, viewers. I'd like to ask you one question, Mr. Lodge.
Yes.
Can a pregnant woman with COVID-19 be cared for at home?
Yeah, that is possible. Remember, pregnant women or expectant women are considered, vulnerable groups. But there are certain exceptions with respect to this group. When a pregnant woman, for instance, is immunosuppressed, in that case, it might be challenging because they would need specialized care. And then number two, these pregnant women also, when they are over 60 years old, there's a possibility of another, at that age. Sorry, not really 60 years old, but when they are when they have other underlying conditions.
Okay.
That was the point. When they have other underlying conditions like cardiovascular,
Yes,
disease.
correct.
We have things like lung disease, cancers. It becomes very challenging. They need specialized care, so they need a more specialized area with standards to take care of them.
Yeah, okay. So a pregnant woman who is relatively healthy,
Yes.
even though if she contracts COVID-19, it's possible that she can be cared for at home.
Yes.
Okay.
But there's also this group that is obese. If they are obese, then they will probably need more
specialized care.
Yes.
If a pregnant woman is maybe obese or has some other conditions,
Yes.
then she can be taken care of at the health facility. Yes, but a relatively healthy pregnant woman may be taken care of at home. What about children? Can you comment on children also when it comes to home-based care?
Yeah, when it comes to children need a lot of attention from parents. So the environment in which they are taken care of, the care must consider the presence of the guardians or the parents, so that the children are not depressed in the process when they are isolated from their parents. And so for children also there are certain factors that you need to consider. Mostly and by and large, it's still the standard in infection prevention measures. The same standards apply even to children in terms of housing, in terms of the care that is on the children. There are certain symptoms that are unique to children, which the medical worker in charge or the caregiver should be sensitive with respect to. And so those symptoms, once taken care of, it would just suffice, so that children are also treated as vulnerable group.
Yes, thank you, Mr. Oloch. I like the way you have summarized, especially the aspect of the vulnerable groups,
Yes.
okay,
Yes.
being taken care of at home in this time of COVID-19 and the infection prevention and control measures that are a little bit confined or unique to
Yes.
COVID-19.
Yes.
And even the general ones also should always be taken into consideration and should always be regarded. When you have patients with COVID-19 and you want to care for them at home, again, he has also said something very important, that we should also periodically invite a health care worker or a medical worker to come and check on a patient who is taken care of at home. So thank you, Mr. Olosh, for being part of our interview. I just want to just ask one last question, and then we can close our interview for the day. Or people who are taking care of patients at home, what advice can you give them? And even those in the house, living in the same house with a COVID-19 patient, what advice can you give so that others in the house will not be at risk or will not be exposed to infection?
Yeah, thank you very much. That's a very important question, especially with respect to other household members. It is very, very important that the other household members are informed about the condition of the patient, and then that as much as possible they should avoid the isolated section for taking care of the patient to reduce the risk of spread of the disease to them. And if at all they need to see the patient, it should be a very specific number of them going to see the patient. And then again, they should be privy to the infection prevention control standards. I mean, they should understand what the patient is going through, and they should provide the necessary support around the patient. If any of them is to access the section, they need to, for instance, have their medical masks on. They need to keep the physical distance at least 1 meter away from the patient, because remember, COVID-19 is transmitted through droplets. So when the patient probably by accident sneezes or coughs, they are likely to get the droplets, and by so doing, they get infected by it. So they need to observe the infection prevention standards within the home. They need also to provide, to be very keen to observe the progress of the disease on the patient, especially the caregiver who is directly in charge, so that in a situation where the symptoms become very serious, especially in the advanced stage of COVID-19, like now there's a lot of serious coughing, headache, higher respiratory distress, it's very advanced, you are able to see that the patient is deteriorating. In such instances, they need to probably take the patient and relocate the patient to maybe a designated care center, so that the risk of spread of this disease to the household members is significantly reduced. So by and large, the people in charge, the other members of the household need to take extra care. In the home also, there are those shared spaces within the homes. Like, let's take for instance, the isolated room is part of the building where other household members also stay. Those shared rooms and spaces must be controlled. If these other household members get into these places, they need to have their medical masks on, just to make sure that these standards are observed. Something else that I forgot, I think under infection prevention control standard, that I think I need to emphasize is the need for disinfection of the surfaces within the room where the patient is isolated, because maybe the patient touched some open surfaces. There are common surfaces like the doorknobs, the window handles, the table where the patient is served. Very, very important. Also, at home, with respect to these, other household members, things like the utensils that the patient uses must be set aside, that they're just used by the patient. Things like the laundry materials, the waste that is generated within the isolated room by the patient. Other household members should not come into contact with this waste, because recently WHO has categorized those wastes as highly infectious wastes. So this waste should be separated, put in very strong bags, and then disposed separately. They should not be mixed with the other household general needs. So generally, those are some of the measures that the household needs to take care of when it comes to the home environment with a COVID-19 patient within the home environment.
Mr. Evans Oluoch
Yes.
Odiwar, we are so happy that you were able to come on this program of the science behind health, and you have given us all of these very important measures
Yes.
that people should observe at home, especially emphasizing on the infection prevention and control measures that may sound simple but are very important for us to think about. So if you have a patient at home, viewers, give care, give love, show concern, but be careful on protecting and be serious about protecting others in the home from COVID-19 disease. We live in times when it is possible that people will have patients for COVID-19, even in the home. Remember, the infection prevention and control measures, taking care of utensils, sterilizing the tables, creating space, and even if you will have to go and see that patient, wear your mask and stand a distance from the patient. If it becomes too serious and the patient needs to be taken to a healthcare facility, take that measure and take that decision to transfer that patient to a healthcare facility if there is one. But all in all, he has told us that we should always try to emphasize on the infection prevention and control measures for COVID-19 at home. Thank you once again, viewers. Thank you, Mr. Oluoch. We are Baraton TV, airing from the beautiful campus of the University of Eastern Africa, Baraton. Goodbye and see you next time.
Thank you very
Goodbye.
much. Thank you very much.